thank you for joining us as we celebrate the Office of Directors recipients of the 2021 NIH Directors Awards. OD staff continue to amaze me with their diligence and dedication to the agency and our mission. From the continuous efforts our staff have displayed navigating every facet of our COVID-19 response, to include our RADx initiative, innovating approaches and strategies for COVID-19 testing for our most vulnerable and impacted communities, to the creativity and care shown to how we recruit and develop our scholars and early stage investigators. The work done by these individuals is exceptional. We also recognize the efforts of the staff helping to make the NIH a more diverse and inclusive workplace. We are determined to make this agency an environment free of racism, harassment, and discrimination. We thank the staff who are willing to partner with us, help us identify our shortcomings, and most importantly, chart a better path forward. These are just a few areas where our staff have displayed outstanding work. I could go on, but I've been asked to keep my remarks very brief. So I will close by once again saying thank you to the OD staff for all you do, and congratulations to all of the award recipients.
Hello, and congratulations to the recipients of the Scientific and Medical OD Honors Awards. It has certainly been a very busy yet important year for NIH, and I commend all of you for the long hours and dedication that went into ensuring that we continue to move forward in our science, despite the challenges that were brought forth by the pandemic. Your efforts were tireless, enduring, and exceptional when it came to developing and implementing programs to address COVID-19. All of this was, of course, done while maintaining excellence in leading efforts that are central to our mission of turning discovery into health. From strategic planning to support of our early stage investigators, we are excited and so proud of the collaboration, determination, and effort that are evident in the work that went into these projects that we are celebrating today. We thank you for the continued excellence that our staff embodies within the OD. Again, congratulations to each of you.
Active Implementation Team, for extraordinary dedication and teamwork to support the accelerating COVID-19 therapeutic interventions and vaccine partnership and expediting effective therapeutics to treat COVID-19. Animal Welfare during COVID-19 Communications Team, for exceptional efforts in developing critical communication resources to aid research institutions facing unprecedented challenges in maintaining animal care operations during the pandemic. COVID-19 Contact Investigations Team, for tireless efforts to conduct swift and excellent contact tracing for all cases of COVID-19 in the NIH staff population. COVID-19 Positive Result Team, for exceptional compassion and dedication in support of over 1,000 COVID-diagnosed NIH staff members and guiding them to a safe return to work. CATS Early Stage Investigator Award Committee, for exceptional efforts and leadership in launching the CATS ESI program to provide a new pathway for early-stage investigators to propose research. NIH-wide Strategic Plan Working Group, in recognition of leadership and collaboration in the development of the NIH-wide Strategic Plan for fiscal years 2021 through 2025. Public NIH COVID-19 Website Team, for rapidly developing and launching key website initiatives that convey critical information to the public about the NIH response to the COVID-19 pandemic. RADx Underserved Populations, RADx Up Working Group, for outstanding contribution, coordination, and implementation of the RADx Up initiative to better understand and address health disparities associated with COVID-19. RADx Up Data Harmonization Workgroup Chairs, for exceptional skill and leadership developing data harmonization guidance for the RADx Up initiative. Rapid Acceleration of Diagnostics, RADx-RAD Working Group, for excellence in leadership and implementation of the Rapid Acceleration of Diagnostics Radical Initiative to support new, non-traditional technologies that address gaps in COVID-19 testing. Trans-NIH Strategic Plan for COVID-19 Research Team for the rapid development of a roadmap for the NIH strategic research response to the COVID-19 pandemic. Heike Balin for outstanding leadership, coordination, and development of the occupational medical response to the COVID-19 pandemic.
Hello, I'm Dr. Alfred Johnson, the NIH Deputy Director for Management, and I'm pleased to join you to celebrate the amazing accomplishments of our administrative staff. Our OD colleagues responded to the COVID-19 pandemic providing essential equipment, symptomatic COVID-19 testing and contact tracing, COVID-19 vaccine administration, responsive communication, and mental health assistance. Additionally, administrative and infrastructure colleagues provided increased staff safety, facilities pandemic preparation, enabled COVID-19 research, and managed COVID-19 VIP special events. The OD administrative community met the challenges of COVID-19 while promoting an equitable and inclusive workplace, providing tribal consultation of an NIH national research program, return to the physical workspace guidance, and virtual trainings and seminars. Moreover, you developed a special government employee portal, a distinguished scholars program, and a HEAL data ecosystem while ensuring ERA cloud migration, open data sharing repositories, foreign and insider threat mitigation, increased NIH grantee security, and a successful presidential transition. The administrative community demonstrated unwavering support to the NIH mission. I thank you for all you do for the NIH and the American people. Congratulations to all our colleagues who are NIH Directors Award recipients.
8 changes for racial equity, for extraordinary, thoughtful communication and efforts towards ensuring an inclusive workplace climate free from racism, harassment, and discrimination, especially within the NIH scientific community. All of Us Researcher Tribal Consultation Team, for completion of the first ever tribal consultation of a national research program at NIH. BMIC Repository Characteristics Subgroup, for extraordinary efforts in developing the desired characteristics for open data sharing repositories, which led the way to the OSTP desirable characteristics. Call Center Team, for the outstanding coordination and implementation of the COVID-19 call center to address health and safety concerns of the NIH workforce. Carline Team, for extraordinary efforts to operate a drive-through sampling site for symptomatic testing and helping to track and curb the COVID-19 pandemic. Distinguished Scholars Program Developers, for visionary and creative leadership in the design and implementation of the NIH Distinguished Scholars Program. Division of Logistics Services COVID-19 Response Team, for expert and innovative logistics solutions to safely enable continuous NIH operations and research during the COVID-19 pandemic. ERA Cloud Migration Team, for successfully planning and executing the complex migration of the ERA system to a cloud environment with no disruption to system users. NIH COVID-19 VIP and Special Events Team, for leading the organization and coordination of COVID-19 VIP and special events. NIH HEAL Data Ecosystem Team, for exceptional and energetic creativity in the creation of the NIH HEAL Data Ecosystem. NIH OHR Pandemic Communications Team, for delivering increased and transparent communication to NIH leadership, management, and the community at large regarding timely human resources matters throughout the COVID-19 pandemic. NIH Return to the Physical Workspace Team, for their extraordinary efforts in the design, implementation, and agile management of the NIH Return to the Physical Workspace framework and guidance. NIH Virtual Seminar Planning Team, for exceptional leadership in planning and executing the first NIH virtual seminar in program funding and grants administration. OER Stepping Up to Enable COVID Research Team, for exceptional efforts providing policy, guidance, systems, and other support to enable the robust extramural research response to the COVID-19 pandemic challenges. OHR COVID-19 Workforce Support Team, for the delivery of exceptional HR services to support NIH continuity of operations and staff during the COVID-19 pandemic. OMA's Investigations and Liaison Team, for the exceptional service to the NIH by enhancing the agency's ability to detect, identify, and mitigate the activities of foreign influence and insider threats. ORS COVID-19 Response Team, for the outstanding NIH COVID-19 response to all aspects of safety, health, operations, child care provisions, fire protection, parking, food service, and operations. Presidential Transition Preparation Team, for outstanding dedication to the preparation of transition materials ahead of the 2020 general election. Public Communication on Coronavirus Team, for playing a central role in developing, coordinating, and communicating important health information as part of the COVID-19 pandemic response. SGE Portal Working Group, for exemplary effort in the establishment and launch of the NIH Special Government Employee Portal for NIH Advisory Committee members. Staff Communication on Coronavirus Team, for developing and deploying a communication plan for NIH staff to ensure they received important and timely information during the COVID-19 pandemic. Trans NIH COVID-19 Mental Health Response Team, for remarkable dedication and contributions to the mental health of the NIH community and for providing exceptional resources and support during the COVID-19 pandemic. Two-factor authentication for grantees implementation team, for exceptional efforts in increasing the security and integrity of NIH grants data by implementing two-factor authentication for the external applicant, recipient, and reviewer communities. Jessica McCormick L., for outstanding leadership and coordination of the overall safety aspects of the NIH COVID-19 response. Renata Miles, for extraordinary and sustained performance in carrying out internal and external communication activities in response to the COVID-19 pandemic. Donna Phillips, for exceptional leadership, professionalism, and commitment in preparation for and response to the COVID-19 pandemic at NIH sites in Maryland, Montana, and North Carolina. Jordan Southers, in recognition of the formation and continued leadership of the COVID-19 Incident Management Team, the stand-up of the car line, and distribution of COVID-19 vaccines. Gigi Stortz, for exceptional dedication and persistence in establishing the NIH Equity Committee.
Hello, OD. I'd like to echo the sentiments of my colleagues, Drs. Tabak, Alkin, and Johnson. It's a privilege and a pleasure to work for an agency with a mission as noble as the NIH, and I'm honored to be surrounded by individuals that go above and beyond to help us achieve our mission. I must especially commend all of our award recipients for the exceptional work as we continue to navigate really new and different times. We've experienced many changes in the last year and a half. And as we consider the awards acknowledging our coordinated response to the COVID-19 pandemic, this is just one example of how you rise to any occasion. You do this while also ensuring the day-to-day functions of the OD are carried out seamlessly. The way our staff adapts and excels in every circumstance is truly remarkable. I'm proud to work with such an outstanding group of professionals. I offer my sincere thanks for a job well done. And once again, congratulations to all of our award recipients.